Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today we are at the beautiful headquarters of Cano Health with such a nice production team. I feel so honored to be here and received by the amazing staff of Cano Health. And with me today is Sandra Ochoa. Not only is she a good friend, is she a board member of the South Florida Hispanic Chamber, she's vice president of Cano Health. She's all over. I don't know how she does it because I, for one, I'm very hyper, but I think she beats me. And Sandra's not easy to beat me. So Sandra, I am so happy to be here with your amazing team and with you, someone whom I admire very much. So tell me, how do you feel today here, just having a good time, relaxed, doing the Business Minute?
I love it. And we've been trying to get together
for months.
For months now. So I'm extremely excited that we're here finally, that we're able to have this great interview with you. Thank you, Lily, for taking your time as well. You're extremely busy.
I'm happy to be here.
So welcome to our Cano family and welcome to our home.
And tell me about your role. When did you start in Cano and what specifically is your role? Because probably all of our members want to know. They see you in the chamber, but they don't know what you do. So just explain a little bit and elaborate about your role here at Cano Health.
Of course. So I've been with Cano for 3 years now.
Okay.
I came to Cano when it initially started almost.
Wow.
When the first week I came in here, we had 19 centers. And on the very first week, they said, by next week, we're going to have 37 centers.
Okay.
So I'm like, okay, that was a great way of starting my week. So my role here in Cano is I'm the Vice President of Member Engagement. I oversee everything related to growth, membership, retaining our members, bringing in new members, and most importantly, providing the best health that we can provide to our communities and to our membership here in Cano. I oversee nationwide this activity that I just described.
Right.
Right now we are in 7 states. And
I was going to ask you about that. Tell me, what states are those?
So we are in Florida, we are in Texas, we are in New Mexico, we are in Nevada, we are in Illinois, and California, and I'm sure I'm missing a few more, but and Puerto Rico.
Estados latinos, que tenemos que siempre decir aquí un poquito algo en español.
Un poquito
Estados donde la población mayormente es hispana y les encanta seguro Cano.
No, sí, les
Claro,
encanta.
el servicio tan lindo que tienen ustedes aquí
Porque
tan
nuestra
bueno.
cultura es hispana.
Claro, claro.
Nuestro CEO es cubano y la mayoría de nuestros equipos ejecutivos son latinos y hablamos español.
Claro,
y
claro.
Nuestro enfoque es para nuestros pacientes que sean latinos. Vemos todo tipo de cultura, no solamente latinos,
Claro, claro.
incluyendo anglos también, pero nuestra cultura es hispana.
Hispana. ¿Y qué los distingue a ustedes de otras organizaciones? ¿Cuál es el sello especial? Ese toque tan lindo, aparte del corazón grande que tiene Cano, ¿verdad? Que hace que ustedes, todo el mundo venga. Cuando se oye la palabra Cano, a mí me da, viendo ahora mismo el logo aquí delante de mí, me da como felicidad, da alegría. ¿Qué es lo que los diferencia a ustedes?
Pues bueno, creo que lo describiste súper bien. Creo que esa diferencia, esa alegría, ¿quién los trae? Los latinos.
Exacto.
¿Verdad? Los latinos. Entonces, nos damos cuenta cuando estamos en los diferentes estados, en Texas, por ejemplo, que no son tanto cubanos como aquí en Miami, en la Florida, son más mexicanos, pero esa cultura, ese amor, ese corazón de la familia que te saluda, que te abraza, eso hace a Cano único.
El toque humano.
Eso lo hace único. Poder tener un doctor que te hable en español, tener el equipo médico que te hable en español,
Claro.
Que cuando vas a un front desk te dicen buenos días, ¿sabes? Eso muchos latinos, no solamente aquí en Florida, porque en la Florida somos un poco blessed, que donde quiera que uno va se habla español, pero en otros estados eso no existe.
No,
Todo el mundo es mucho más inglés. Pero cuando va a un centro de Cano y se sienten relacionado con esa persona y se siente que le hablan en español, eso hace una
Te
diferencia.
abre las puertas, claro,
grandísima.
cambia la relación. ¿Y qué otros servicios proveen ustedes?
Bueno, en Cano tenemos todo como una sombrilla, como llamo
umbrella,
yo.
exacto.
Un gran umbrella. So, tenemos no solamente la parte primaria del doctor, ¿no? La parte médica, pero también tenemos otros servicios añadidos como la fisioterapia. Eso
Claro.
es muy importante.
Muchísimo.
Especialmente ya después que uno le van cogiendo los añitos, todo le empieza a doler, que si la rodilla, que si la espalda. Entonces eso es un servicio espectacular que tenemos. Tenemos los centros de wellness, que damos todas las clases de ejercicios, tenemos
Qué
gimnasios,
rico.
hacemos las clases de zumba, clases de
Ay.
nutrición. Tenemos también dental en nuestros centros. Todos los servicios dentales, los pacientes no tienen que ir a ningún lado, se hace todo acá. Tenemos social services,
Okay.
Cualquier servicio social. Que la persona necesite se hace en nuestros centros.
Y también se provee servicio a las personas que no son senior citizens.
También.
Personas de cualquier edad, ustedes proveen entonces el seguro médico de Cano.
Correcto. Cano tiene nationwide más de 200. I'm going to say it in English.
Yeah, of course. Yeah, let's go back. Let's go back to English.
250,000 members, okay? 250,000 members nationwide. And out of that 250,000 members is a breakdown of seniors, right? For Medicare. We also have the private insurance, and we have pediatrics also.
Okay.
So in some of our centers, we do see pediatrics. So we see the whole gamma of members, everything.
And what market do you see you're making the biggest impact, I guess, besides Miami?
Well, besides Florida, I think Florida is our home, is where we started Cano. But in Florida, there is other similar brands like ours. And people are kind of already used to seeing our model of care. Where we're really making a big impact is where we call our expansion markets. Okay. For example, Texas. I was just mentioning Texas. That's huge for us. Why? Because in Texas, there is so much need. Of having Hispanic companies coming into the market and doing what we do, providing the service. Some of the patients in Texas have told us that when they go to the doctor's office, they feel like if the doctors are doing them a favor. And they're treating them that way. Like, oh, come, I'll do you a favor, I'll see you. And that shouldn't be, and that is not fair. So when they come to a Cano center and they feel like family, and we are able to welcome them with open arms, that's making a huge difference. So Texas for us, right now we are in Rio Grande Valley, which is right next to it's a border town. Okay. It's right next to the border. We are in San Antonio.
I love that city.
We are in Houston. San Antonio is beautiful, I know. We just opened up in Houston. Okay. And we're also in Corpus Christi, the home of Selena.
Ay, qué lindo. So, Selena, of course, of course.
So we're in Corpus Christi as well.
So what do you do to help local businesses and communities? And you know that's a question that's important for us as a Chamber of Commerce, because what we do is provide services to the business community. So tell me, what are you doing with businesses?
Yes.
Besides working with us in the South Florida Hispanic Chamber of Commerce.
Right. Well, so I'm part of the board, so that's
very
already,
important. Yeah, of course.
So that's already a huge connection that we share. But other than that, sometimes people see Cano as just the doctor's company, right? The doctor provider company.
This is more than that. This is more than that.
Yes, that is more than that. First of all, we're providing jobs to our communities. We have more than 4,500 employees in Cano nationwide, which is it's a big amount. But even further than that, do you know with how many businesses we're doing business in a daily basis? From the construction business, from the...
Right, because you're building so many centers.
We are.
So you're providing opportunity to many small businesses.
100%. So much other stuff happening just with the construction business. Then obviously we have everything else that's needed to run an office, right? From
supplies, everything, exactly. Yes. Technology. Yes.
We do so many events. So I mean, it's
so you're supporting small businesses.
Everything.
And that is such an important topic.
Everything across the board, and
not only health, but you're supporting and you're giving back to the community by hiring all these people.
Absolutely, and we urge everyone in the chamber, all the businesses that work with us to communicate with us, right? And let us know if they want to do business with us, what type of business they have. They can definitely reach out to us, and we can continue the conversation.
I love it. So Sandra, well, I think that's all for today, because this is a business minute. Usually it's not more than 10 minutes. So I want to thank you so much for being on a business minute with Lily Lopez. I'm honored to work not only with you, with the leadership of Cano, and I'll see all of you next week at the same time. And I thank you so much for tuning every week to a business minute with Lily Lopez. And I'll see you next week at the same time. Thank you.